My name is Doncha McDonald. I have a master's degree from Stanford in documentary film. I had a Fulbright scholarship to the Czech Republic, and I'm also a person with schizoaffective disorder, which is a pretty severe mental illness. When I was 32 in the Czech Republic on my Fulbright, I started having trouble telling reality from imagination. It's just that part of my brain that knew I wasn't running the CIA was broken, and I thought there were cameras following me everywhere, and I thought anybody with a phone was a spy. I thought there were special messages and newspaper headlines. So that got worse and worse for about 7 years. They couldn't find a medication that worked for me, and I was very resistant about changing my medication. I really believed all my delusions were true. So I gradually started to lose everything. I lost my first marriage, I lost my career, and I came to Kansas because my father is a professor at K-State. And things got worse here. I was taken to Osawatomie and they force medicated me, and I was better in 3 days. So I found meaning in it, and I'm working to help make change for other people.
I'm Aaron Estabrook. I am working at Job Corps. I am the father of 2 daughters and the proud husband of Doncha McDonald. After I graduated from K-State, I enlisted in the Army, served in Afghanistan for a year, and then as we transitioned back, the struggle that I had was not just the symptoms that were PTSD, but dealing with how to fit back into society. We had had quite a few suicides in my company after we got back. There was 13 suicides in a year. Not so different than what we experienced at Fort Riley recently. So that's promoted me to talk about it, to be an advocate, because you never know when that window is open for somebody.
So something I've learned about mental illness is that it can happen to anyone. It doesn't matter what socioeconomic class you're in, what kind of family you grew up in. It can affect anyone. We need different levels of care for people in different situations. A lot of crises can be resolved in a couple of days. The acute phase of it can be very short, and that is what the Crisis Stabilization Center is seeking to fill. And it also helps people get help that if they didn't get help at that time, might end up in jail, might end up at the state hospital, which can be a traumatic life event in itself.
Hello, I'm Lieutenant Darrell Lasher with the Riley County Police Department. I'm a watch commander on the patrol division. So our calls for service when it comes to mental health can be very great. We have a large college here, Kansas State University, which brings in a different demographic of people every semester, as well as the military post, which is Fort Riley. We have a lot of people that are away from their family and friends that may not be able to deal with the problems that they're facing. And mental health is a big call that we receive, whether it's providing help to get up to the hospital, or if they're experiencing some suicidal type thoughts. Them are things that officers deal with on a day-to-day basis. In law enforcement, we have what's called protective custody, and it's immediate harm to themselves or others. And if they are deemed to be that, take them to our nearest facility, which is Via Christi, and then it is the doctor's determination to see if they are placed in long-term care. When we take them up to get evaluated, they become our responsibility as a department. So that officer may be tied up for 10 hours. It could be 2 days until they're accepted somewhere. When you're dealing with that call, and then you have to also manage criminal calls, you have to weigh what is the bigger protection need. And if we had more resources available, I think the care provided to the person would be better.
Hi, my name is Julie Miller. I'm the Emergency Department Supervisor for Via Christi in Manhattan. We're an 18-bed emergency department. On average, we see between 60 to 65 patients a day. In a year, we'll see close to 28,000 patients that come through the door of our emergency room for treatment. For the size of our ER and the population, yeah, we do stay busy. Typically a 24-hour period, we're going to see a variety of patients, anywhere from your stub toe to heart attacks, strokes, those kind of things. And intermixed in that is going to be the behavioral health patients. We're seeing very young children coming in, as well as the geriatric population. They lose their mates, they lose their friends. That can lead to depression and feelings of hopelessness and that kind of thing. I looked back over the month of September to see just how many patients we did see with a behavioral complaint. We saw 53 patients, and of those 53, 26 of them had to be transferred someplace else. Some of them are sent home on a safety plan. Others are here for 2 or 3 days waiting until we can find a bed for them. They're in a safe place. Their basic needs are being met, but as far as the behavioral health need of that inpatient therapy is not being met, because that's not what we're trained to do here. Ideally, we would like those patients that are primarily in need of medication management, maybe a safe place to be for 2 or 3 days to behavior to stabilize, that kind of thing. Those would be the ideal patients to be sent directly to a crisis house in lieu of coming to an emergency department where it's crazy, it's loud, it's chaotic. It doesn't do anything to calm their feelings of anxiety.
Hi, I'm Kyle Applegarth. I'm the Undersheriff in Washington County. I've been working here for about the last 8 years. We've got about 5,000 to 6,000 residents spread out over about 900 square miles. Washington, the town we're in now, is the most populated town in the county. We've got 1,000 people here. Pretty much everybody around here takes care of themselves. There's always your small town talk when people have problems, but the people that have problems don't tend to discuss it out in public very often. We've had people call in when a pipe bursts in their home. So we are the first call for a lot of things, and mental health is one of those things. So oftentimes when a person is having thoughts of harming themselves, the very first place they call is 911, and they get us. I think it's actually a pretty big need. It's not uncommon for us to get calls relating to mental health 2 or 3 times a week. Around here, when they have some kind of a crisis, they will usually see us first. Oftentimes from there, we'll go to the hospital where we get some help from the medical professionals there. If that pans out, maybe they can be referred down to Topeka, Salina, Wichita, maybe Manhattan. Last I knew, there was an 18-bed waiting list for involuntary commitments to the state hospital. That holds back a lot of counties. A lot of sheriffs will come out and say, we've got people that need some care here. We've got people that have mental health issues that may be even sitting in their jail, and they can't get them the care that they need because the services are just so limited, whether it be in their community or whether it be at the state level. There are a lot of people that need help. Anything that we're able to get in terms of extra mental health in the community is going to be a boon for everyone.
Hi, my name is Bruce Johnson, the Crisis Stabilization Manager here at Pawnee Mental Health. Crisis Stabilization Services fill that gap between outpatient services and inpatient services. And Crisis Stabilization provides members out there in the community a place locally, close to home, where they can come 24 hours a day, 7 days a week, and receive some immediate care without having to go all the way into hospital setting, 2 to 3 hours away. Because we're not a full-blown hospital, we've got a lot more flexibility, meaning that we've got case managers and therapists here that can help them resolve problems that you couldn't do in a hospital setting. A lot of people can't imagine you're having a problem right now, you've got to go away for 10 days to a hospital and you're not going to have access to your phone, the internet, computers, and all sorts of things. We couldn't do it. We would be worried about who's going to take care of our dog, who's going to pay the water bill that's due tomorrow, and that sort of thing. So by having a crisis stabilization service right here in the community within our 10-county area, we're able to keep them in touch with all of those different pieces that they need so they don't turn into barriers for actually getting the services. Crisis stabilization is not only providing the right care in the right place at the right time, it also shows that it's very, very cost effective. All of the research indicates that. The most conservative figures show that for every dollar spent in crisis stabilization actually saves a little over $2 out there in the community and other resources. So it's very, very expensive to have somebody in jail and very, very expensive to have somebody in the hospital. And the biggest deal is that they're not getting the type of help that they need. So it's also an economical way to be able to do things as well, besides being the right thing to do.